When you stack up how people feel about measles, COVID-19, and influenza, measles is perceived as the most dangerous out of the three.
That perceived severity is not necessarily translating into a consensus on vaccinations.
83% of Canadians view the measles vaccine as safe. 80% say the same for the flu. But only 71% of people think the same for the COVID-19 vaccine, according to polling done by Ipsos for Global News. Canada's chief public health officer says the majority of the recent measles cases reported in Canada are in people who are not vaccinated against the disease. And Dr. Theresa Tam says a risk assessment found it is possible infections from international travel could cause outbreaks in childcare and preschool centers, healthcare facilities, and the wider community. Ipsos Senior Vice President Sean Simpson says there are strong opinions on whether vaccines should be mandatory for children, with the dividing line being a person's age.
If you're 55 or older, around 7 in 10 believe that measles vaccine should be mandatory. And if you're under 55, it's only about half who believe that the measles vaccine should be mandatory, even if parents object to it. So 50% is obviously not a majority, not close to approaching consensus, and actually means that it is becoming quite a divisive issue in this country.
Furthermore, roughly a third of Canadians say they don't think people need vaccines to build immunity. And perhaps not surprisingly, the data shows nearly a quarter of people don't even want to bring up the touchy topic of vaccines with friends and family. Health Minister Mark Holland acknowledges vaccine hesitancy is a challenge and wants to see politics taken out of health information.
There's a lot of different views, but there are some places we shouldn't cross swords. And when we do, we confuse people. It's so unfortunate and tragic watching people get so sick when it's totally preventable.
Katherine Ward, Global News, Toronto.